Hello everybody, we are here with Mazen, and he is with Resilience, and we're going to talk about cell therapy here at ASGCT 2025. Thank you for joining me.
Of course, thank you.
And what do you do for Resilience?
I'm in the advanced R&D group, creating new technologies, developing new technologies to advance cell therapies.
You mean you're in the Cool Club?
I am.
I'm going to go through a couple of questions just to talk about the cell therapy industry as a whole and maybe some things that you guys are doing here at Resilience.
Absolutely.
Let's do it. Okay. What's one innovation or trend in cell therapy that has you most excited right now?
I believe the applicability to going beyond oncology, most specifically autoimmune. I think if we can figure out the autoimmune thing and make it a little bit more generalizable, it's a game changer in the field for patients specifically.
Absolutely. If you had to describe your company's approach to cell therapy manufacturing in just 3 words, what would those be?
I'll do even better. It's 2 words: increasing accessibility.
And tell me more about that. What is Resilience doing to increase accessibility?
So what we're trying to do 2 parts. First of all, right now is just increasing the capacity. There's not enough capacity in the world to be able to treat all of the patients that are needed. The second thing is developing the technology. That's why the Cool World is the Cool Club. Advanced R&D group is developing new technologies to solve the QC issue. Most people right now are focused on the manufacturing, automation manufacturing. We believe that QC is going to be the next wall that the field's going to hit. We're trying to solve it now.
That's excellent. Staying ahead of the curve.
Yes.
What's one challenge in cell therapy that you think the industry must solve in the next 5 years?
Right now we're treating 20% of the patients that need it, 20 to 25%, depending on which study you look at. How can we get to actually be able to get the therapies to all the patients who can use it, can benefit from it?
That's very mission driven.
Absolutely.
I like that too. Tell us what makes your manufacturing processes or capabilities stand out from the crowd.
Yes, that's what actually we're focusing on. So as I mentioned, we're developing a new platform for QC. Our platform will be making QC more generalizable, easier to do, reducing the cost and reducing the turnaround time. So 48 hours, single sample goes in, and it just cuts the cost by 50% and the turnaround time by about 90%.
That's the best of both worlds.
Yes.
Good thinking. What's one thing that you wish more people could understand about cell therapy manufacturing?
The cell therapy manufacturing has, by and large, it's been solved. A lot of people, a lot of drug developers are trying to focus on cell therapy manufacturing. They should focus on the medicine, the therapy. Mm-hmm. There are enough companies out there that are trying to figure out the cell therapy manufacturing that they should reach out to more people, and not just Resilience, but a lot of other companies that have quite a few really good solutions. Turn to your partners in the technology field. Let them focus on the therapy and the medicines, and let others focus on the manufacturing and the technologies.
Find a good partner that knows the industry, knows the regulation landscape, and can help you run that gauntlet.
Absolutely, yeah.
If you could fast forward a number of years into the future, what do you hope to see in cell therapy next?
Cell therapy moving to first line of treatments. It's been shown that it is very efficacious, very safe. Safer than many of the first-line treatments that are being used right now. I'd love to see cell therapy move to, and I think we're moving to that.
This one's kind of fun, talks about your culture and your team.
Yeah.
So what's one of the proudest moments that you might have had with your team recently?
One of the proudest moments will be published in a couple of months. Not something that I can talk about just yet.
That's a teaser. That's called a teaser, people. He's also in marketing, I think.
Yeah. Yes, in a couple of months there will be publication on the proudest moment.
Okay, we'll look forward to that.
Yeah.
That's great. Keeping it moving forward, right?
Yeah.
What's one word you use to describe this moment in the evolution of cell therapy?
Potential. There is a huge potential for cell therapy, and I think we're starting to see the potential of it right now.
Are you a sportsman at all? Do you like sports?
I do.
Okay, so I was going to ask this kind of a fun question.
Okay.
If you could pick a sport that would describe cell therapy, what would that be?
Tennis?
Tell me more about that.
A lot of back and forth.
Yes.
It's and I think whether it's from the technology and therapy developers or from the therapy developers and the regulatory agencies, we're all learning, and there's a lot of back and forth going between all the players. The regulatory agencies have done a tremendous job of being open to hearing from the therapy developers, from the technology developers. It's been great engagement. Over the past 10 years that I've been involved in this field, I've had some very frank conversations with the regulatory agencies. They were open. They said, teach us more. And same thing with the therapy developers. Initially, when therapy developers were first started to develop therapies, they were very closed in, and they would not be open to having open discussions. More recently, you start to see a lot more openness in this conversation.
I love that analogy. That's great. Mazen, thank you so much for the time.
Of course.
We really do appreciate it. Hope you have a great show here at ASGCT.
Thank you so much.
Thank you.
All right.